I'm Dr. Mark Santa, and I'm the CEO of Breakthrough Coaching. And it's my pleasure, along with MichiCare, to bring you this presentation, Multidisciplinary Practice the Right Way, the do's and don'ts of integrated practice. Well, for 25 years, Breakthrough Coaching has been honoring a commitment to take the most conservative approach to multidisciplinary practice management. And we are absolutely honored that MichiCare has chosen to endorse Breakthrough Coaching as their official multidisciplinary practice management consultant. We've had some amazing recent changes in Michigan law as of March of 2022. And I'm going to read you the citations. It's a Public Act 31 of 2022, House Bill 5295, and also the Public Act 32 of 2022. That's the House Bill 5296. And these bills amend the Michigan Limited Liability Company Act and the Business Corporation Act. And this is in respect to two really groundbreaking and important things. Number one, the new rules allow one or more individuals licensed to engage in the practice of chiropractic, that's right, that's you, chiropractic, to organize a professional limited liability company or a professional corporation with one or more individuals licensed in the practice of chiropractic. Here's the new one: practice of medicine, practice of osteopathic medicine and surgery, or the practice of podiatric medicine and surgery. The rules also allow one or more individuals licensed to engage in the practice of chiropractic to organize a PLLC or PC with one or more licensed PAs or physician's assistants. And this is provided that a physician licensed to engage in the practice of medicine or osteopathic medicine or surgery is also a member of the PLLC. So MAC developed these MDP rules back in March of 2022. Here's the shocker. Prior to the enactment of these bills, Michigan law required that all members or managers of a PC or PLLC that renders a professional service included in the Public Health Code to be licensed or legally authorized in Michigan to render the same professional service. No apples and oranges, no chiropractic, no medical. But because chiropractic physicians do not prescribe pharmaceuticals or perform surgery, they have been deemed not providing the same services as MD or DO. These new laws absolutely revolutionize your ability, as in most other states in the country, in Michigan, now to work in conjunction in the same PLLC or PC as your medical colleagues. Now, a medical decision-making process and adding that to a chiropractic decision-making process, it's not a simple thing. It really is the next step or next level of success for chiropractic practices. And so the decision to establish a multidisciplinary practice, it's beneficial to practices who have already got a good, strong foundation in being able to run their chiropractic practice successfully. It also doesn't diminish or tarnish the basic tenets of chiropractic philosophy in any way. We have very clear scopes of practice, and when we come together in collaboration, we actually produce a better, more effective, and more efficient outcome. So you may be asking, how do I get started? Well, the addition of this multidisciplinary model requires several preliminary steps, starting with the recruiting of the right medical personnel, as we mentioned in the new rules, as well as the creation of the proper corporate structure. Now, this is necessary because in some states, chiropractors aren't permitted to own medical practices. Now in Michigan, this is a great new thing because you can. Now, this isn't legal sleight of hand, and it's not a method to sprinkle wiffle dust on a chiropractic practice and turn it into a multidisciplinary practice with a few sleights of hand. No, it's also not a method of simply increasing reimbursement revenues by misrepresenting chiropractic services as medical services. And it's also not a way to fraudulently obtain insurance coverage for chiropractic treatment that wouldn't be otherwise covered. No, a multidisciplinary practice should be created for the benefit of your patients. You see, multidisciplinary practices, They offer a broader scope of coordinated services than those available in either a medical, separate physical therapy, or chiropractic practice can do all alone. And they can also deliver these services in a more efficient and cost-effective manner. Breakthrough Coaching requires that its members' practices meet professional staffing requirements. And as mentioned in the new regulations, this may include chiropractors, licensed physical therapists or PTAs, medicals, physicians, doctors of osteopathy, physician extenders such as nurse practitioners and PAs. The sky is really the limit once you have the foundation in place. So as I mentioned, chiropractic services, you're aware, are the services and procedures that are performed by a chiropractor. They are never to be billed incident to or under a medical doctor's license. Reason being is you're considered a physician. Why would a physician bill incident to or under another physician's license? All chiropractic services in your multidisciplinary practice should be billed under the chiropractor's provider number. Same with physical therapy. PT services must be performed by a licensed physical therapist or PTA while under the supervision of a licensed physical therapist. It also requires a current prescription for physical therapy services before any PT services are performed. Michigan, you have a 10-day window that your PT can actually see patients before that script is actually written. Let's talk a little bit about the mathematics of Medicare and federal health insurance. You may wonder why I start there. Well, it's because of the quirk of Medicare law that chiropractic reimbursement or allowable services under Medicare are limited to the chiropractic adjustment alone. By adding a licensed physical therapist, you're going to open up all of the services that you are not currently reimbursed for under the physical therapist license, including evals, therapeutic procedures, and by having simply 6 to 7 Medicare federally insured patients each day, you can afford a full-time physical therapist in your practice, plus generate a significant return on investment. If you're wondering, a PT salary is approximately what you would pay for a chiropractic associate. The only difference is you now have a whole new set of benefits that you can access in your multidisciplinary practice. So you'll see me quote some fees up here. They're all based upon the Detroit MAC Medicare locality 8020201, and those are the fees for 2023. Physical therapy assistants, well, they serve as an adjunct capacity to physical therapists. Here's our PT. They can perform the evals. PTAs can't perform the evals, but they can perform all of the other therapeutic procedures. They perform these treatments as directed by the physical therapist. PTAs are distinguished from PTs in that they're not able to perform the assessment or eval or discharge patients. And they're distinguished from unlicensed physical therapy aides in that they can treat patients without supervision and sign patient charts without a therapist's co-signature. Medicare has different rules than most third-party payers, and they require that PT to be directly on site. So Medicare and federal health insurance require that PT to be on site when PTs bill. And a PTA can't bill for physical therapy procedures when the PTA is not in the house, not on site. Once approximately 20 or so visits a day are performed by your PT, that's the time to bring in a PTA and have your PT focus on performing the evaluations, and the PTA or more PTAs perform the therapy services. Private insurance services, and again, these are all just sort of ballpark for you to have a general idea. We're not suggesting that we set fees in any certain way, but physician services or private insurances, about 143% of Medicare rates on average is what they are. That ranges from about 118 to 179% of the Medicare rates. So a good rule of thumb is to bill about 150% of the Medicare fee for your private insurance companies. Most insurance companies are going to list the percentage of Medicare fee schedule that they'll pay on their websites. And that's a great thing to do prior to entering into your multidisciplinary practice. In Breakthrough Coaching, we recommend 3 units of PT based on medical necessity. There are essentially 4 PT codes: 97140 manual therapy, 97110 therapeutic exercises, 97530 therapeutic activities, and 97112 neuromuscular reeducation. And according to Medicare Detroit, they average about $37 reimbursement per unit. So let's do the math. You all know the 8-minute rule. First unit is 8 minutes. Second unit and each additional unit thereafter requires another 15 minutes. So let's say your PT is doing 4 units. That's a total of 4 units compared to doing 3 units on a patient and then starting another new patient. Here's what I mean. Second unit is 15 minutes. Third unit is 15 minutes. Next new patient is 8 minutes. What does that mean? I've generated about 160 in revenue on the left-hand side of the screen for 53 minutes of patient care versus 46 minutes for that same amount of reimbursement. The mathematics really doesn't add up doing more than 3 units of therapy on an individual patient. And this part of what will help you do in Breakthrough Coaching is develop these treatment protocols to make sure that you are absolutely following medical necessity and compliance while you're maximizing the profitability of your practice. Adding a PT is like having a new practice within your practice. It can provide a significant source of new patients. In fact, you'll be able to market that PT department for direct referrals. It becomes that practice within your practice. Now, well, medical doctors in your area, they just might hesitate to refer to a chiropractor. Well, it's not quite the same. All day long, they're sending referrals to physical therapists right and left. Well, why not have it be your physical therapist? So let's talk a little bit about multidisciplinary legal compliance. Well, I'm not a lawyer. I did stay at Holiday Inn Express one night, but we aren't an attorney. We don't dispense legal advice. We actually work with your state association's attorneys to help you. You have a great one there in Michigan to help you correctly structure your corporations. For legal advice, we recommend always that our members retain local legal counsel familiar with the group practice healthcare laws and regulations in the state in which the practice will be established. So the corporate practice of medicine, or CPOM doctrine, is what is in effect here. And the CPOM, it's regarded as an odd feature of the healthcare law landscape. Many of the CPOM doctrines are on the books since the 1920s and 30s in some states in the country. So that's why it's pretty radical that yours was changed up in 2022. Product of the 19th century. So the corporate practice of medicine encapsulates this single principle that physicians must make autonomous decisions, not be impacted by outside sources or financial motivations. And although the application varies in roughly 30 states that follow CPOM, the basic idea is that a business corporation may not practice medicine or employ physicians or other clinical personnel to provide professional medical services. In Michigan, your attorney will create a single PLLC, or professional limited liability company, that has 2 classes of membership interest. Membership interest is similar to stock, although it allows us to create dual classes or multiple classes of membership interest. So on the right-hand side of the screen, you see a purple box representative of the PLLC, and inside we'll have management membership interest, and that's the interest that manages all of the business decisions of the practice. There's a full schedule of those particular decision-making processes. That's everything from hiring and staffing, physical plant maintenance, software, EHR, everything that it takes to run your practice, save one thing: medical decision-making. And for that reason, we create medical membership interest. Now, in this single unified corporation, Both chiropractors and medical physicians, PAs, or other staff will have W-2 employment agreements. We are all employees of that same LLC, and that is a wonderful, wonderful option for you to have. It truly, truly streamlines the process that you would not be able to do by having to have separate medical corporations and management corporations. So I mentioned the medical doctor, who would be termed the medical director of the practice. Here are his or her duties. They actually coordinate the multidisciplinary team to ensure the quality of care. They're going to ensure that the staff education and compliance with all of our policies are in place. They're going to participate in the selection of suitable treatment modalities and treatment plans for patients. They're going to approve policies and procedures for adequate training of nurses and assistants and technicians. And they're going to assure ongoing quality improvement and compliance programs are implemented. The medical director management, well, we must document the need for medical directorship as stated in the law. We must document the specific duties, as I just mentioned on the previous slide. We have to substantiate before the medical directorship begins that fair market value payment is made to that physician. We'll talk a little bit about ghost ownership, and that's something we don't want to do. And then, assuming an annual payment is going to be made, the facility and the physician need to document in the contract the hours desired by the facility, that's the multidisciplinary practice, and accomplish those documented duties and responsibilities. And this all has to be a written agreement that is signed and developed by all parties. So let's talk about some additional multidisciplinary corporate compliance. There we are, the scary ghost owning doctors. Gee, I see this so often where management consultants come into an area and they say, oh, I'll provide you with an owner doctor. And gosh, what you find out is that owner doctor isn't just owning and performing the medical directorship for your multidisciplinary practice, but I've seen 10, 11, 12 practices, and obviously that's not something that can be supported in terms of a bona fide role. So we have in Breakthrough Coaching a very strict policy against ghost or paper-only physician ownership. In states that require an MD to own all or part of the stock, and that's Michigan, that owning physician must have a documented and ongoing role in the practice. In fact, all stockholders of a PA, PC, a PLLC must make a financial contribution to that corporation. How would you form a corporation with anyone else without having a financial contribution? Doesn't make any sense. Next, no blended billing. The provider that performs a service must be identified on the claim form. As I mentioned before, chiro services performed by a chiropractor are never billed under a medical doctor's provider number. All chiropractic services are provided under the DC's provider number. Same thing with MD and PT services. The person who does the service charts the note, documents it, substantiates medical necessity, and it gets billed under their provider number. Standing orders is a crazy thing that was developed many years ago, and I still see some of this happening across the country. Standing orders are when the services are billed under the medical provider's number without the medical doctor ever seeing the patient or writing a diagnosis or ordering a care. They just have these standing orders that say that you can begin treating the patient under my license without me ever having seen the patient. A multidisciplinary practice should absolutely have a strong, strong policy against standing orders. These are all things that don't pass the sniff test, right? Doesn't smell right? It probably isn't. If it doesn't occur anywhere else in the real world, why should it occur within the four walls of your multidisciplinary practice? It makes common sense. No bouncing as well. So you've had a chiropractic practice for many years. You're now establishing a new tax ID number of the PLLC. This is now a group practice employing physicians, medical doctors, chiropractors, PAs, PTs, etc. Patients may not receive care under more than one tax ID number in which an owning physician has a financial interest. You can't have them see chiropractic under your chiropractic old corporate tax ID number and then have them receive additional services under your multidisciplinary. This bouncing back and forth is illegal. Multidisciplinary practice is a group practice. It's going to be credentialed as a group practice. Everyone's credentials are going to be attached to that group practice. And we identify, as I mentioned before, the services provided by the individual practice members by their provider number. Mention a word about credentialing. Really important. This is one of the things MichiCare does for its members. In many cases, you'll need to establish provider numbers if they already don't have them, or PINs associated with the new group practice. If somebody has already provider numbers, you're going to attach them to the new group practice ID. This process, called credentialing, is tedious. It can take several months. That's why you want to have professionals help you do it, because a small error can kick things out and then you have to restart the process over and over again. So the time of onboarding professional staff is integral to controlling the startup overhead of the multidisciplinary practice. We actually, in Breakthrough Coaching, help you coordinate that in a step-by-step fashion to make sure that you're maintaining your overhead, keeping it in a way that is manageable so that you don't overwhelm yourself with a whole bunch of overhead before you actually start generating cash flow. No duplication of services, right? There's my twins, cute. No duplication of services should occur by the various MDP professional providers. For example, manual therapy 97140 shouldn't be done by a chiropractor and then also under the physical therapist under that same tax ID number. Why would you have two providers performing the same therapy on the same set of goals for the same reasons? That's duplication of services, and it's unnecessary. You want an independent but coordinated treatment protocol. All of your staff should adopt this set treatment protocol. And in Breakthrough Coaching, we help train all of your team on this, help bring them together so that you have a truly collaborative practice working all together for the benefits of your patient. Professional staff members have to have autonomy, but they can work in an independent and yet coordinated fashion. And you want to have documentation of this agreement so that you can be sure that none of the professionals are directing each other of what to do, but they're collaborating together to make sure that the patients receive the best care. Multidisciplinary practice, just like your chiropractic practice, must have an effective compliance program in place. And this includes the designation of a compliance officer or committee, baseline compliance audits, and then an annual compliance audit of your documentation and coding. Your fee schedule for the multidisciplinary practice should be reasonable and customary for the region in which your practice is located. We'll help you do that together. Once you've established this multidisciplinary practice, you can expand with ancillary services. And I have seen all sorts of stuff out there. I've seen just add a nurse practitioner to your practice and you're going to have another $300,000 a year. Well, as you can see already in our presentation, it's not quite that simple. However, once you do have the proper structure, staffing, and compliance in place, wow, the sky's the limit. Expanding with ancillary services in your multidisciplinary practice can generate additional sources of revenue, new patients, and most importantly, diversify your revenue stream. Chiropractors without a medical provider on staff are required to refer most of these services to their medical colleagues outside of their practice. In a properly run multidisciplinary practice, many of the procedures can be performed by your existing medical staff with some additional education and training required at times. We help you with that. So we take a step-by-step approach of adding services to multidisciplinary practice. We just don't throw a whole lot of stuff at the wall. Foundational for your medical staff is E&M coding. So you'll probably have a PA or nurse practitioner who's performing these procedures. Rarely are they performed by the medical doctor. In fact, your medical director doesn't even need to be credentialed because that person is not actually going to be billing under their license. All of these procedures are going to be performed by a PA or nurse practitioner, and they'll be identified by their provider numbers. So first step is E&M coding, evaluation and management coding. Next step, super easy, trigger point injections, little saline lidocaine, easy as can be. The next step after that is you can begin doing some joint injections. There are tons of knees and elbows and other extremities that can use the supportive approach of joint injections. And these injections can begin with things very simple, such as a corticosteroid, move up to things like viscose or hyaluronic acid in terms of putting in some sort of a lubricant into the joints. And then you can actually move to PRP, or platelet-rich plasma. And that's where we actually extract the patient's blood, spin it down, and then re-eject it so it supports growth and healing in the actual joint itself and can regenerate cartilage, used in many, many different procedures. There's a whole world of things that you can do. People love adding IV nutrition therapy or medical weight loss to their multidisciplinary practice. Regenerative medicine injections or hormone replacement therapy. Aesthetic procedures. Once you can do the stuff on the left, the stuff on the right is very, very easy. Allergy testing and much, much more. So, multidisciplinary practice, we want to do it the right way. What does Breakthrough Coaching do for you? Well, along with MichiCare, we're going to advise on the recruitment of medical and physical therapy personnel. We'll work with your attorney in the selection of the appropriate state-specific corporate structure, your PLLC in Michigan. We'll actually help work with training. We have tremendous video modules, online learning library that is absolutely robust. Every aspect that you will need, from new forms, new documentation, coding in your particular software, we'll be able to work with you. And we work to train each individual department and discipline. We'll assist with this interprofessional communications. So collaboration means not only on a patient care way, but also with your professional staff, your accountant, your attorneys, any professional staff, even your financial planner. A multidisciplinary practice can generate significantly more income than a chiropractic practice. And if you're not ready for that from a tax perspective or a financial planning perspective, you can dig yourself a big hole, and I don't want that to happen for you. We'll advise you on the purchase of your supplies and equipment. That includes billing with MichiCare if you're going to outsource it. Billing will actually advise you with electronic health record software. We'll advise you on the capitalization needs. What type of money should you have set aside in terms of cash on hand or a credit line that's going to be drawn upon, or bank loan. We'll work with you on the administrative protocols for operating the multidisciplinary practice. And of course, we're going to advise you on billing, coding, and documentation procedures. Once you've got this set up, man, you want to market it and tell the world about it. So we'll help you with web and social media marketing. We'll help you develop professional relationships in the community so that you can tap into the referral network that's all around you like oxygen. Just as a chiropractor, you're not participating in it the way the medical community does. And of course, we'll help you with the creation and development of your quality assurance and your compliance programs as well. You can take a snapshot of the QR code and download our multidisciplinary practice guide, Multidisciplinary Practice the Right Way. This is Dr. Mark Santa, and on behalf of myself and all of the team at MichiCare, we wish you to make today an exceptional day, and we look forward to helping you build a successful multidisciplinary practice the right way.